The following segment is sponsored by Intermountain Healthcare. Now, as you've been watching, KUTV has some experts from Intermountain Healthcare on hand today.
That's right. With the inversion, it really has people's asthma acting up. We have Dr. Colten Bracken from Utah Valley Family Medicine Center. Okay, doctor, how should people be treating their asthma symptoms right now? Because it's bad.
Yeah, so I mean, if you've seen the inversion, it's terrible right now, and asthma symptoms are going to flare up. The treatment of asthma is based on getting the medicines to where you need it. So asthma is a disease of the lungs. We want to get the medicines into the lungs. And so the therapies are inhaled medications as opposed to pills in most cases.
Okay.
And this shrinks, then what helps is it opens up airways, basically.
Exactly, yeah. So asthma is where you have inflammation and constriction of the muscles in the airways. And so we have a couple of therapies. One is a steroid that actually decreases the inflammation and opens up a little bit. And then the more common one would be like albuterol, which relaxes the smooth muscles, and it's a very immediate increase in the airflow that you can get to your lungs so you can breathe easier.
Do people need to be getting different inhalers right now if they have asthma, or using theirs more often?
It's a good question, and probably the best answer would be to talk with your doctor to find out how often you're having symptoms, if they're waking you up from sleep. If it's causing you enough problems, you may have to step up your therapy, which means more than just the albuterol, you may need a steroid to help control your symptoms.
With it, okay. And a lot of people may be surprised to know that they're not even using their inhaler right. I mean, I would have no idea. I would think you would just kind of press it and you inhale and
don't you get instructions from, you'd think you get instructions from the doctor on that, right?
You would think so, but not always. And studies have shown that up to 90% of people that use inhalers don't use them correctly.
90?
Yeah,
wow.
Which is significant, and if you're not using them correctly, you're not getting the medication to where it needs to go, and it's not going to help.
Okay, so you're going to show us?
Yeah, so I brought some demonstrators that we're going to have you guys actually give yourself a dose of medication. Now these are demonstrators. There's no active medication in here.
I was just going to say that.
But it does have a propellant in here, so you can actually see that it gives a simulated dose. So it's very important that anytime you use, now this is what we call a metered dose inhaler, or a puffer, oftentimes called, and oftentimes this is what albuterol is given by.
Okay.
So when you take the medication, you want to shake it really good.
Okay, we only have like 30 seconds left, so I want to make sure
you want to breathe out, put it into your inhaler, and then seal this over your lips, and then breathe in as you depress.
Okay.
Okay. So breathe all the way out. Good. And then the most important part is to hold that breath for 5 to 10 seconds to let the medication set in.
You turn blue.
Really? And then breathe out. Great.
There you
did
go.
Perfect. You did perfect.
So hold it. Okay.
Yes.
Okay, good to know.
Did you feel anything? Because it's just stuff.
No, I did feel when that came through, and then holding it in. You did, yeah. So let's make sure to hold it. Okay.
Good stuff, especially right now, right?
Where can people go for more information?
So you can go to Intermountain Healthcare. There's patient education materials. Go to your doctor, go to your pharmacist. Seek help if you need it.
Okay.
Thanks,
You're
Colten.
amazing. Thank you. So good to know. And you can give them a call all day long right now at 877-908-0680 for any of your questions. Thanks so much.
Yeah.